nurses,
Great.
excellent nurses,
Excellent.
scientific nurses. Thank you, Dr.
Scientific.
Ruth, for for introducing the three of us. And I would like to welcome you to our speech today. This is rewinding health mission to improve access to care. And like Dr. Ruth said, these are going to be presented by myself, Titilola Turton, Dr. Grace, and Miss Esther. Who are we? All interested members of NANNA is part of this team. Friends of NANNA, like you know, anybody that wants to be a friend, they are welcome. And any other that believe in our projects. What we do in the US, health education in our community health outreach, collaboration with other organizations, faith-based organization, whether Muslim, Christian, or Jewish, any religion you belong to, you can fit in with us. What we do in Nigeria, we started with Take Us to Your Village, which so many people were open and said, let me take you to my village. And doing that, I've known a lot of villages or a lot of states that I shouldn't have been to. Thank you, ladies, for taking us to your village. And then we have an health mission that we do in the community to see what is going on with our people. And then we change it to what we call adopted primary health centers, which NANNA, I want to thank NANNA board, NANNA members, because we have 4 states that we can showcase our PHC, which is primary health centers. We have Abia State, headed by Dr. Ngozi, Edo State by Dr. Grace, Imo State by Dr. Iwu, and Ogun State by myself, Titilola Turton, and Miss Esther. And we do collaboration with nursing schools, hospitals, practice settings. The requirements that we put in place for health outreach outside the United States. When you take us out to your village, you need to arrange how to feed us, security, transportation, and accommodation. Those are the 4 things we require. And I believe we had taking medication also to that. If you are right now, if you are taking us to your village, because we adopt the primary health center, it's called self-sponsored. Requirement for somebody to take us to their village: accommodation, transportation, medication, and supplies and security. NANNA will give you the logistics. We have wealth of knowledge. We have a lot of things we can put together for you. But you have to give us the accommodation, transportation, medication and supply, and security. In preparation to go, we have a visibility study must be performed before you commence. We just don't want to go to where you don't know what is going on with the area you are going to, which is the very big key. You should receive extensive pre-departure training, especially in such areas as social, cross-cultural communication, political, economical reality of the community to which you'll be going. Because you want to make sure that you know your area, you know what you need to do. You don't want to step on anybody's toes. And we always work with the Nigerian embassy abroad, have a role to play in this predicament. Okay, by saying that, I will be handing over to my co-partner, my Dr. continue from there. Thank you. You can see the passion that everybody has in this project. In conclusion, you've heard it. And I know so many people are working behind the scene already on this project because everybody knows what NANNA stands for. And I would like to say, even if you want to do the primary center by yourself, we have some pick one that is going to be their own for their state. It is excellent. And we're going to be throwing so many models out, how whoever is doing that, so that we can copy the right things from each person. Because you cannot do it by yourself alone. It is not easy, I'll tell you. It's involving. But if a state wants to, you are welcome to bind together and do it. I will have a shout out to Delaware. They started their plans, and they are taking NANNA model to the teeth. Thank you. And then for us, in conclusion, there's a quote that said, tomorrow leaders will be those with a taste of paradox, a talent for organization ambiguity, and the capacity to hold new and dismay ideas, comfortability in their minds. They will lead by conviction, not by power. This is by Alan Cleveland. And we have for us, please, we need help. To contact us, we meet every last Sunday of the month. And like last Saturday of the month. And we meet our time. I want to give a shout out to California because their time is 8 a.m. and they are always the most represented. And then we have Central Time will be 10 o'clock, Eastern Time will be 11 o'clock. Nigerian time will be 4 p.m. Our chairperson, which is me, and Miss Esther, my co-partner, Esther Shule, and our great secretary, Miss Constant Umar. Thank you all. Thank you all, Medical Mission team. We've done a great work. And this will conclude our talk.